Our next speaker today is Lieutenant General Dr. Umesh Kumar Sharma. He's a retired medical army officer and recipient of the Ati Vishish Seva Medal, specializing in nephrology with a focus on preventing chronic kidney disease. Sir, you'll have to let me do my job. Everyone is in a hurry, but I have to do my job and follow protocols. Throughout his distinguished service spanning over 38 years, he has served in various capacities, including as the President's Honorary Surgeon and Commandant and the Director of the prestigious Army Hospital, Referral and Research in New Delhi. He has contributed to over 1,000 renal transplants. There's more, but I shall stop here. Over to you, Doctor.
Thank you. Thank you so much. No, I'm sure the audience didn't want to hear all of that. Well, dignitaries on the dais and all the esteemed guests, at the outset, I consider it a singular honor to be here on the invitation of Mr. Nair and through the very kind uh, this thing of Admiral Ashok Kumar, I think, who thought of me to be here. I mean, this book, my wife would tell you, when it came to me for a review, I finished reading it in one single go. It took me a little less than 24 hours, and I actually read it from cover to cover. I was curious. I heard that the book is about beyond the pandemic, means the pandemic has happened, and now what are we going to look forward to? And it's been written by 3 different authors, each a stalwart in his field. One, a medical professional, one, a statesman and a diplomat, and the third, a deep thinker and a professor. I wondered how the book has been put together, whether they've written individual essays and strung them together. To my utter surprise, I found that it's a seamless writing by the 3 of them. You can make out who would have contributed what, but it is not disparate essays. It's one beautifully flowing text, and it was eminently enjoyable going through that for 2 reasons. In spite of all the problems that the pandemic brought to our country, in spite of some challenges which looked unsurmountable to begin with, India comes out on top, as Mr. Amitabh Kant just finished telling you, for the very deft handling of this pandemic in the overall scenario. We did have our problems, and the authors have beautifully pointed out what we went through to begin with, where we were making our mistakes. We overcame them all, and we actually led the way for the rest of the globe. So, I mean, it was a pleasure to celebrate that through this book. But we couldn't be possibly be resting on our laurels, because the book's title is Beyond the Pandemic. So we have to look beyond it. So I looked for what all the authors have proposed in this. And like I said, after having shown us that our administrators, our healthcare professionals, every single citizen of this country, under the guidance of the government of India, its executive officers, and the Honorable Prime Minister, actually put the shoulder to the wheel and brought the chariot called India out of this muck. We saw what havoc the pandemic created to our education, to our economy, to our social fabric to our very lives. And in a very short period of time, we actually managed to beat the pandemic, come out of this mess. The second wave has been beautifully referred to in the book. It was a terrible time indeed. We overcame even that kind of a madness in this country. And so my chest swelled with pride because we were also part of that effort as healthcare professionals. A lot of my colleagues whom I've personally known, nurses as well as doctors, were actually lost to this pandemic. And I say a silent prayer in their memory, but with their efforts and with the effort of an average citizen of India, we managed to beat the thing. So we can all be proud of that fact. And the book brings it out beautifully. But far more importantly, what this book tells us is what needs to be done in future, what can be achieved, and how India can lead the globe in its quest for sustainable, good quality healthcare. And those lessons are the ones that a serious student of public health should imbibe from this book. It's a must read for those people as well as policy planners and even government departments. And I keep hearing this particular Sanskrit word uh, wrongly pronounced, of course. It's Vasudhaiva Kutumbakam because Vasudha is earth. And they all say Vasudev, who was actually Krishna's. So it is Vasudhaiva Kutumbakam. We showed the world how actually the world is one family. And that was marvelous. My pet chapter in the book is chapter 9, Reinventing the Primary Health Care. And here I must put in a word for Armed Forces Medical Services, which I served for 38 and a half years after having passed out of Armed Forces Medical College. So if you add those 4.5 years to that, you will get 42 and a half years of association with Armed Forces. We have a beautiful healthcare model in Armed Forces. Admiral Ashok Kumar would gladly tell you our absolutely basic medical unit is called an MI room even today. An MI room stands for Medical Inspection Room. It means not necessarily the person who reports there is sick, but is examined in order to look for problems and in order to give him preventive health care. Armed forces believe that treatment is not enough. What is far, far more important is to prevent diseases. Secondly, we have such a well oiled healthcare system where we have these MI rooms and then we have primary care hospitals, which are small, tiny hospitals, often less than 150 beds, and often with only medical officers or one odd medical specialist, a specialist. If the patient cannot be managed there at armed forces expense, up the chain, he is referred to a secondary care hospital, which has at least 6 basic specialties specialists: surgeon, physician, gynecologist, pediatrician, the radiologist, and the pathologist. So he can get better care at the secondary care. If he cannot be managed at secondary care hospital, he is transferred to a tertiary care hospital, which is also called a command hospital because it has multiple super specialty officers posted in there. And finally comes quaternary care. I was fortunate to command Army Hospital Referral and Research at Delhi. It's a quaternary care facility. All the command hospitals of Indian Armed Forces transfer their cases here if they cannot manage them. And all of this is done by the armed forces. So it's a beautiful, seamless system. And this is what is argued in reinventing our primary health care. That basic touch of a general, doctor at the root level is so important, is not happening these days. People come with about 25 investigations and ask for a gastroenterologist, a cardiologist. I want to see a urologist, having met nobody else. So that is not exactly the way to provide sustainable, good quality health care. So I, in fact, implore our planners to study the armed forces model and try and apply that to the rest of the country. Uh, in conclusion, actually, our master compeers already chanted that Sanskrit shloka. Armed Forces Medical Services have a motto, again in Sanskrit, beyond Vasudhaiva Kutumbakam, and that is Sarve Santu Niramaya. May all be free of disease. That is what the armed forces strive to do through preventive care more than therapeutic care, through treatment. And if the world did not divide itself with artificial boundaries, if we really cooperated, the globe, the earth can actually attain the goal of Sarve Santu Niramaya, where all will be disease free someday. Thank you.